Hello everyone, welcome to Logic Medico, where we understand the concepts in medicine. Today's interesting topic is pre-operative radiological examination. So why is it done for a patient with cochlear implant who is trying to undergo cochlear implant? Why a pre-operative radiological examination is important? It is important for the selection of the patient of cochlear implant, whether the patient is suitable or not. So that's why we do pre-operatively radiological examination. In order to diagnose any type of inner ear malformation, if at all some inner ear malformation is there, then we can't do cochlear implant. Also to identify any abnormalities within the temporal bone. If there are some abnormalities within the temporal bone, like a fracture or the tumor or the fusion, at that time the cochlear implant may not be benefit the patient. Hence, pre-operative radiological examination of a patient undergoing cochlear implant becomes important. To understand this, we'll know the indications of the patients for cochlear implants and the contraindication. Sir, what is indication? Indication means where these are the patients who are suitable for cochlear implant. Who are they? Number one, the children between the age 12 months to 24 months with profound sensory neural hearing loss, more than 90 decibels. They benefit from cochlear implant. Second point, children 2 years to 17 years with profound sensory neural hearing loss, more than 70 decibels, will benefit from cochlear implant. Then third point, adults with moderate to profound sensory neural hearing loss in both the ears of more than 40 decibels. Kindly note, younger the child, higher the decibel. Children less than 2 years, 90 decibels. 2 to 17 years, 70 decibels. Above 17 years, that is in adults, 18 years plus, 40 decibels is considered as profound sensory neural hearing loss. These are the patients who benefit from cochlear implant. Recently, a patient with single-sided sensory neural hearing loss can also be operated for cochlear implant, and vestibular schwannoma on one side is also suitable for cochlear implant. These are the patients who benefit from cochlear implant. Hence, pre-operative radiological examination in them will have a better outcome to know whether they are suitable for surgery or not. If at all on radiological examination we find some of these following things, that means they are not suitable for surgery. So what are these? They are called as contraindications for cochlear implant. Number one, complete labyrinthine aplasia. The entire inner ear is aplastic. It's not developed. Or only the cochlea is not developed. Cochlear aplasia. Or complete cochlea has undergone ossification where the calcium salt is deposited. The fluid can't move whatsoever. Complete cochlear ossification. Or the nerve beginning from the cochlea, so called cochlear nerve, that is aplastic. Cochlear nerve aplasia. These are the absolute contraindications for cochlear implant, which means if you do cochlear implant in them, they won't benefit, they won't start hearing because of these conditions. Also in children with charge syndrome. So what is this charge? C for coloboma of the eye. Coloboma means a cleft will be there in the sclera of the eyeball. Then heart defect, either VSD, ventricular septal defect, atrial septal defect, or patent ductus arteriosus. Heart defect will be there. H for heart defects. A for atresia of nasal cone. So what is this nasal cone? The anterior nasal aperture is called as nostrils. The posterior nasal aperture is called as cone. So that cone undergoes atresia, means a wall is there in that. Then R for retardation of growth. The child won't grow much in height and weight. It is growth retardation. Then G for genital abnormalities or urinary abnormalities. Genitourinary tract abnormalities. E for ear abnormalities. So this is the meaning of charge syndrome. Other patients who are not suitable for cochlear implant includes child which has got following things: the cerebral palsy, autism child, attention deficit hyperactivity disorder child. These three child, even if you do cochlear implant, because of the child's brain and mind, it won't respond to you. So therefore, cochlear implant should not be done in these child. Also, when you do a radiograph of CT scan and MRI, we can diagnose the otitis media, mastocytitis, which are the acute infections, Otitis media is infection of middle ear. Mastocytitis is infection of mastoidantrum. These are the contraindications for surgery. And a person with infection, CSOM, chronic suppurative otitis media, and a small stratified squamous epithelium growing the middle ear, cholesteatoma. These patients' infective condition, first it has to be controlled, and then if they are suitable for surgery, then the surgery is done. Otherwise, cochlear implant should not be done in any patient with infection of the ear. Because what will happen if you do the surgery? You will make a new root. The infection will start spreading because blood will spill, right? So infectious agent will enter the blood. So it will result in septicemia. Hence, otitis media, mastocytitis, CSOM and cholesteatoma, these patients we should not do surgery, especially cochlear implant. Otherwise, it will result in septicemia. So we understood in this video, preoperative radiological evaluation of a patient is important before cochlear implant, because we should know whether the patient will benefit from cochlear implant or not. By doing a radiology, either the CT scan or MRI, CT scan computerized tomography, the heart tissues are clearly visible like bony tissues, like the temporal bone anatomy can be studied. If at all there is some abnormality, there is no point doing cochlear implant. Another one, MRI, will do MRI to know the soft tissues, especially within the inner ear. There is endolymph, perilymph, basilar membrane, resinous membrane, vascular membrane. So in order to diagnose any type of abnormalities within this inner ear, and if at all these abnormalities are there, there is no point doing cochlear implant. If we do also, the patient won't benefit out of it. That is why pre-operative radiological examination becomes important. Thank you for watching and learning from Logic Medico. Kindly press the thumbs up icon to support this video, and don't forget to press the subscribe button and the bell icon. Thank you.